on the NewsChannel 5 network. This is Open Line.
Good evening, everyone, and welcome to Open Line. Thank you for joining us on this Monday evening. I'm Carrie Sharp. Tonight, we are talking about the coronavirus, and I tell you, we could not have a better guest joining us to answer your questions. Dr. David Aronoff. You have seen him on our coverage throughout the last couple of weeks on NewsChannel 5. He is the Director of Division of Infectious Diseases at Vanderbilt University Medical Center. The top guy to talk about coronavirus is here with us, again, to answer your questions. So go ahead, call in, get those questions coming. I'll ask the questions for right now. But first of all, Dr. Aronoff, thank you for joining us.
What a pleasure. Thank you for having me on, Carrie. I really appreciate it.
Absolutely. We're just delighted that you would spend an hour with us. So many people have questions about this virus, even though we have covered it now, it seems nonstop for several weeks, maybe even up to a month. But it seems like information keeps evolving and changing. And I want to start with that University of Washington model that we've been talking about for the past couple of days. The numbers from last week to today, after the governor issued the stay-at-home order, those numbers have changed drastically. And just for our viewers' benefit, to show the big change, when we talk about the number of deaths before the governor's stay-at-home order, that model predicted that Tennessee would see 3,200 deaths. Just now, though, today, that model shows that we could see about 567. What a difference. Is this model, can it be trusted?
Well, all models really are creating predictions based on existing information. And just like weather forecasting, sometimes it's really accurate and sometimes it's close, but not quite. And sometimes it's just off. So that particular model is using, I think, the best data that can be gleaned from departments of health, from hospitals, and really trying to predict the future. I think what we're learning with this pandemic is that every day is something new, and it's a little hard to predict the future. But I do think the main message that with people staying at home, doing their part, and participating in social distancing, we're very much seeing predictions about the impact of this virus on the state of Tennessee improving a great deal. Whether the numbers end up being exactly right, I think we'll just have to leave that to how things are going to play out and see what the future holds. But I'm optimistic that what this is really telling us is that now's the time to keep doing what we're doing because it appears to be having an impact.
And at the same time, we saw the death count in Tennessee really take a big jump today, about a 50% jump. And the governor and also Dr. Piercy mentioned in the press conference today to not read too much into that, although each death is tragic. But it really shows a trend starting about 2 weeks ago, since this virus, they said, can take about 2 weeks to really see the end point. Can you tell me more about that, how we should be reading into this death count and the jump?
Yeah, so what we think our efforts to slow the spread of this virus are really doing is reducing the number of cases that we're diagnosing every day. That's what flattening the curve is all about. One of the unfortunate realities of this infection is that people can die from it, and those deaths generally occur fairly late into the infection, somewhere on the order of 2 to 3 weeks after someone is diagnosed is when they may die of the infection, at least most commonly. So the efforts that we're doing to prevent the spread, it appears that we're seeing now that new cases that are diagnosed are slowing down. But the deaths, to see an improvement in the daily number of lives lost, that may lag a little bit, because remember, the patients who have died in the last 24 hours probably got diagnosed 2 or 3 weeks ago, before we were really doing as much as we could do to shelter in place. So there is going to be a lag, and we've seen that in, for example, Italy, where the number of cases began to crest, sort of getting on the backside of that curve, but the number of deaths continued to climb and then lagged and trailed. And that may be what we're seeing here, although it's probably a bit early to say for sure.
I'm sure you spend hours poring over the numbers. I would assume so. Correct me if I'm wrong. And really looking at these models and the trends of other countries, what do you expect for Tennessee over the next week or so?
Well, I think we're going to continue to see new cases. All of us in healthcare in Tennessee are bracing for a potential surge of cases because we've seen that in surrounding states and surrounding cities. New Orleans as a close example, Birmingham, Alabama, Atlanta, Georgia. So far, we haven't really seen that surge in Nashville, Davidson County, or across Tennessee, but we're not going to let our guard down, and we're preparing as if we're going to see a surge of patients. We certainly hope that we don't, and I think that the next couple of weeks will be really telling for us, because what we're seeing now, and we talked about this a little bit with that new model suggesting that the impact of the virus will be less than we thought in Tennessee, is that these are pretty early new predictions based on a recent mandate from the governor, a relatively recent mandate from Mayor Cooper here in Nashville. And so to be really sure that we're able to flatten the curve, I think we need to take the next week or two and assess. And I'm certainly hopeful that tomorrow is another good day.
Are you concerned with how long it is taking for some people to get their test results back? We've heard weeks for some folks.
Yeah, of course, that's very concerning because people are anxious when they get tested and they want to know. As we've heard stories across the United States, testing has been a little bit slow to start. And I think that this pandemic caught us on our heels a little bit with regard to testing. And we're still finding that testing is a bit of a patchwork quilt, where some institutions are able to do their own testing and keep up with volume of testing done and turn around results very quickly, and others are not able to do that. And some of the big commercial labs that do testing from samples that come in from all over the country also experience some backlogs. And so we've seen variability from hours to days to, unfortunately, in some case, weeks. My sense is that overall this is improving, and I think that this is another benefit of everybody doing their part to slow the spread of this infection, because the slower this infection spreads, the fewer patients present for testing, and that allows the testing facilities, whether they're local or national, to keep up.
I want to take this, just pause for a second and remind our viewers, this is your chance to ask Dr. Aronoff your own questions. Don't let me ask all the questions tonight. The number is at the bottom of the screen, 615-737+. Even though we are social distancing and doing this show a little bit differently, we have to right now. That's the protocol. And but we can still get your questions on the air. The doctor can hear those, and he will answer those tonight. And I hear that David just called in. David, thank you for being with us and being our first caller of the night. What's your question?
Yes. First of all, good evening to you both.
Thank you.
At this point, no problem. At this point, I see a lot of people have always said, usually conservatives, that they want small government. Well, we're seeing where small government is, not always a good thing. You need something to always supersede that is the reigning power, which is the federal government, which is this administration's responsibility. And we're seeing a lack of that, and we're seeing governors have to fight other governors when we're supposed to be one nation under God, the United States of America, but you have governors pitting each other against each other. Supplies come in from China and other places, but the federal government gives them to private entities for governors to have to bid on that. And to me, that's just totally outrageous. And I would like to see what the doctor thinks about it, but we can't continue down this path, because right now we look like not even a third world country. We look like a fourth world country, and I know other countries are looking at us saying, yeah, they're not so big after all. And I'll let you guys, I'll hang up and let you guys respond. Thank you.
David, thank you. Dr. Aronoff, not just as an infectious disease expert here, but as a doctor there at Vanderbilt, what is the situation with supplies? How are you getting them? We've all heard about the desperate need for masks and shields and ventilators.
Yeah, that's a really good question, and I'm very grateful for the caller. I think, supply chain issues have been really important. And one of, again, the collateral benefits of every person doing their part to slow the spread of this infectious disease has been that it has really bought us time. It's bought time for suppliers to make new personal protective equipment. It's provided the opportunity for shipping companies to ship products to hospitals like Vanderbilt. And I think we've all been preparing as much as we can for a potential surge of patients and coming up with guidelines that we use not only at Vanderbilt, but at different hospitals. Everybody has their own guidelines about when to deploy certain types of personal protective equipment to make sure that our stocks are well stocked. Right now, we're doing fine, and we've really benefited from, again, the whole state not seeing yet, hopefully, a surge in patients. So it's a really good question, and I think every hospital is having to deal with these issues around supply, and I'm proud that things, at least so far, are so good are in this area.
It'll be interesting to see how protocols change going forward after all of this is over. Let's go to Heather now. Heather, thank you for joining us. What's your question for the doctor? Heather, go ahead.
Oh, I'm sorry. I barely heard you.
That's okay.
So I got a question, and this might be out there. I just picked up, and I seen y'all were, I was like, hey, they might have the answer. So back in November, December, I'm sure y'all keep hearing this over and over again. I've seen it posted numerous times. I and a couple of other family members, and it spread really fast with us. Whatever it was, we had all caught. It started with me with a dry throat, and then it started feeling almost like I had strep throat, but I had no runniness, and this was back in the end of December, end of November, beginning of December. And I remember telling my mother, hey, I've never felt this. I know this sounds weird, but I've never felt this before. This is a weird stick. It's almost like I got a sinus infection, but it's stuck between my throat and my nose. Mm-hmm. And I ran a little bit of a fever, not like the big high, but it was in the hundreds, like 100, and, teetered between the hundreds. And I remember just feeling kind of tired, and I coughed, and that, there wasn't much production of it. I went to my doctor, and they were like, you're flu negative, and it's just, like they said, an upper respiratory. Mm-hmm. And I was just reading whether Today News or whatever, was saying that it could be likely, but there's not enough, investigation out there, enough data collected. But it spread really fast. Like my son caught it immediately, and then my mother, and then and then I had other family members that were, and we couldn't get rid of this stuff. It ran a course of I'm telling you exactly what's happening is exactly what it was doing then.
Yeah, doctor, what do you say?
Is it possible?
Go ahead. Go ahead, Heather. Is it possible that it was the coronavirus? Is that your question?
Yeah. I mean, how do you feel about that?
Yeah. Heather, it's a great question. I'm going to hang up on you so you can listen to your TV for the answer. Doctor, I've heard this question from a lot of people saying, I had these symptoms in December.
Yeah, what a great question. Heather, thank you for calling with that. This is actually a very common question that I get, and I think there's a couple things to unpack here. One is the first documented case in Tennessee was in early March, March 4th, and so we're just about a month into the documented case of COVID. The first cases that we diagnosed in humans on Earth were way over in China in late December, and it appears to have arrived in the United States sometime in January. And so far, I haven't seen anything that would suggest to me that those data are incorrect. But I think so. I still think it's a bit unlikely that illnesses that people experienced in November or December in Tennessee were due to this particular coronavirus. Now, I will point out that there are lots of viruses that cause people to get bronchitis, sinusitis, and pneumonia that are not influenza, that are seasonal, often affecting people in the winter, and are quite contagious. And of course, now with this pandemic, we're learning about social distancing and hand hygiene and washing our hands. which is really fundamental stuff we should be doing during cold and flu season, particularly when it comes to hand hygiene and coughing into the corner of our arm, etc. There are lots of different viruses that cause sometimes severe respiratory infections, and actually some of them are also coronaviruses. They are seasonal coronaviruses that have been with human populations for many, many years, and we see them come and go year over year. They're not the same thing as this particular COVID-19 virus, which is new to humans. So I would bet that you and your family suffered a viral infection, given by what you said, how much it transmitted through your family. That would be a little less common for a bacterial infection. And I'm really happy that you've recovered. I suspect it was not COVID-19, but I'm really glad you called because that's a very common question. I might say one thing in follow-up to that, which is at some point, and hopefully that will be soon, we will have antibody testing to be able to see if someone has actually been infected with this particular coronavirus, the COVID-19 virus, and their immune system is making antibodies to it, which we can detect. That will tell us if someone's been infected ever in their life, and they may not know it. We think that a proportion of people who get infected never have symptoms, and a larger proportion have mild to moderate symptoms. And so, for example, at some point, you and your family may be able to get tested with antibodies, and it's possible that they would be positive if you got infected here recently, but if they were negative, that would certainly cinch up the notion that what you had back in the late winter was not this COVID-19.
Such a common question. Thank you for answering that, Doctor. Okay, we're going to take a quick break. When we come back, I know that we have Renee and Nancy on the line. If you want to call in too, get those questions coming because it's going to be a hot night, I can tell. We'll be right back after this.